Welcome back to the Hart2Heart Podcast, guys. Today, I'm going to be doing another solo episode. So the reason I'm doing a solo episode today is because of the Dr. Andrew Huberman and Dr. Matthew Hill podcast that was just released this past week on the Huberman Lab podcast. So this is a podcast that discussed cannabis. If you don't know who Dr. Andrew Huberman is, he's one of the most popular podcasters in the world right now. Mostly talks about science and science-based tools to improve life. And what he did recently was he had an interview with Dr. Matthew Hill. Now, that's spurred from actually a little bit of controversy. So Dr. Huberman had recorded a solo podcast on cannabis, and then Dr. Matthew Hill had responded to that and had noticed some discrepancies and retweeted this on Twitter. A lot of people viewed it, saw it. I think it had well over 1 million, maybe a couple million views. And so Dr. Huberman responded to that, and then those two guys got together and had an excellent podcast. I listened to the whole thing. I encourage you guys to listen to it. Just so you know too, it is time stamped, which I think is really helpful for people because it is about 4 hours. So, if you don't want to listen to the whole thing, you can just listen to the parts that you want to listen to by going in the timestamps and doing that. So I do kind of, urge you to do that. It was a really good podcast. So, there were some things that came up on that podcast that, I did want to comment on. And I will say too, that right now, as of now, Dr. Matthew Hill is going to be a guest on this podcast, I believe next month. So that'll be great. Try to clear some things up maybe that weren't cleared up for everybody on the podcast that he did with Andrew Huberman. And again, that's not a knock on either one of those two people or the podcast. It's just the length of time that they have, and the amount of science that there is in cannabis is enormous. So because of that, you just can't cover everything even in 4 hours. And and I'm just gonna talk for about an hour or less here today and just kind of cover a few things that I think some people may appreciate, and some things that I thought that were very interesting that Dr. Matthew Hill said. And I'm going to, move more towards clinic patient side of things. So, the first thing that I thought that he said that was really interesting, and this certainly affects, patients a lot, is CBD dose. So, many of you listen to that podcast may have been surprised that the dosages that Dr. Matthew Hill was discussing with regards to what were used for anxiety disorders, for example, and for various other things, like they were using dosages of like 300 milligrams a day, or 300 milligrams even in one dose at a time. And so this would be considered to be an incredibly or exceptionally high dose for anybody using CBD. And we don't even tend to get people to use doses that high, because there can actually be potentially a little bit of liver damage when you get to doses exceedingly over 300 milligrams a day. So just something to kind of be a little bit concerned about when you get into higher doses. But most patients I find do really well, just with 10, 20 milligrams a few times a day. Some people may need to take, 30 or even 50 milligrams, 3 to 4 times a day. That would be, more on the high side for my patients. Like, most of my patients, again, are taking probably between 10 to 20 milligrams, like, 3 to 4 times a day, sometimes even a little bit less. Sometimes people only need to take like 20 milligrams once a day. It really just depends upon how bad the issue is. And, that's an important point, is how bad is your anxiety? How bad is the issue that you're trying to treat? Or maybe you're trying to treat inflammation, maybe you're trying to treat pain with CBD. And so when you're considering the dose that you need to use, you have to consider how bad your condition is, right? So if someone has severe anxiety, they're probably going to need a much higher dose than someone who just has a little bit of anxiety. So, maybe the patients who are getting away with just using 10 to 20 milligrams a day don't have as crippling anxiety as patients who are using, say, 30 to 50 milligrams a day. That's just kind of one thought I had on that. Regarding like the 300 milligram dose, like I said, like if you look at the studies, those are the dosages used. But when you chat with patients and in clinical practice, they indicate that they certainly get a lot of advantages and a lot of benefits to using CBD at significantly lower doses, right? So, we're not talking 300 milligrams, we're literally talking like, 10 to 20 milligrams. So, like 3%, essentially of the dose, which is obviously significantly less. So one thing that, I will try to maybe chat with Dr. Matthew Hill about, but something that I thought that was very interesting that certainly affects patients. Another point he made or he discussed was talking about THC with the use of CBD. So I've always sort of thought this was almost a little bit of a underrated thing in the medical cannabis space, meaning that I feel that a lot of people who use CBD, I don't want to push THC, but if they're not getting the results that they're looking for just with CBD only, by adding in, 2.5 milligrams, say, and seeing how that goes. And then, if that doesn't work, then maybe you add in, 5 milligrams of THC with your CBD dose, see how that goes. And as Dr. Matthew Hill was saying on the podcast too, like, if you're a naive cannabis user, if you don't use any cannabis, you take 2.5 milligrams, you probably will feel something. You maybe not feel something. At 5 milligrams, you'll definitely, feel something. You'll feel a little bit psychoactive. You'll get the effects of THC. Once you get into 10 milligrams, then I would say that would, you're getting into a space where someone could have potentially a bad experience if they're, a naive cannabis user, and they start off just, using 10 milligrams. That could be a little bit of an issue. But, what I do think is that, adding in just a small amount of THC, sometimes the CBD can make a big difference in terms of treating someone's anxiety or treating someone's pain. And like I said, I can't tell you exactly the dose of THC that won't make you high. But 2.5 milligrams generally is, pretty safe. And if you do feel psychoactive effects, 2.5 milligrams will likely be very, very light, and not too unpleasant. So those were kind of my thoughts on that. But he also made a really interesting point too, and I certainly want to chat with him about how CBD may actually enhance the effect of THC. People have always more or less discussed that if you use CBD with THC, then you may not get as high, right? And so that may be true if you're just using a strain of cannabis that's higher in CBD that just happens to be lower in THC. So if you go from using, a strain that's say 20% THC, and then you go to using a strain that's 10% CBD and 10% THC, well then you're just getting a strain that's 10% less in THC. But then the question is the 10% CBD along with the THC negating some of the high from THC? And Dr. Matthew Hill's answer that was pretty interesting. So that's where he said he thinks that actually there's studies where CBD may actually enhance the high of THC, but I think he said there's other studies where he's seeing more or less the opposite. And so some people tend to think that CBD competes with THC at the CB1 receptor for the same receptor. And so you're saying that that's not how that works at all. And so my, understanding of it was that, and I will ask him about it, is that it's always been an agonist of the antagonist. So essentially CBD would block some of the effects of THC on the receptor, but not necessarily negate its effects in any way. And then what Dr. Matthew Hill said was that CBD may be an allosteric receptor on the CB1 receptor. So basically he's saying is that it may modulate the CB1 receptor so that when the THC attaches, it's not producing quite the same high effects. So just to kind of repeat all that again and to make it clear for everyone, if you're using 20% THC and you go down to 10% CBD, 10% THC, likely most of the reason that you don't feel as high is just because you're smoking 10% or vaping 10% THC instead of 20% CBD. Now, is that 10% CBD, negating some of those effects of the THC? Like I said, CBD may be binding somewhere different on the CB1 receptor and then changing that receptor so that when THC binds to that receptor, it may not produce the typical effects that THC would produce in that context. So again, something that I think is still being teased out in the literature, something that I'll certainly ask Dr. Matthew Hill about. But the other part of that too is that in terms of the mechanism of action of CBD, coming back to, does the 10% of CBD negate that 10% THC? So negating may not be the correct term in terms of like blocking the effects, but it's just that if CBD is having a different effect somewhere else downstream, and it's potentially, reducing anxiety, then that may, reduce some of the so-called negative or paranoid effects that come with THC. So I think there's a lot to, learn in there. I think I have a lot to chat with Dr. Matthew Hill about there. And unfortunately, I know people don't like us saying this, but I don't think we have all of the research to really say, exactly what is going on here right now. And I think if you ask a few different cannabis experts that question, they may give you some answers that may not, be all perfectly lined up. So it is something that we're still teasing out. I will say that from chatting with my patients, absolutely, when you do use high CBD with THC, you still can get a high effect. But some people do report that, when they do use the CBD with THC, they don't get this sort of paranoid effect, right? And so some of that, like I said, may just be that you're using a lower strain of THC, but some may be this, allosteric modulating of the CB1 receptor, so that when THC binds that CB1 receptor, doesn't produce quite the same effects that it normally does. Another thing he kind of pointed out there too is kind of interesting. I mentioned like 20% THC, but you'll notice that I said, but what happens when you use 10% CBD and 10% THC? I didn't say, what happens when you use 30% CBD and 30% THC? And so the reason being is because it doesn't really seem like those strains right now really exist. Like in terms of high, low, medium potency, we have those for THC in massively wide ranges. So meaning you can get strains that are like, 2 to 4% THC. You can get strains that are 7 to 10, 10 to 20. And then you can also get strains that are like 37 and even higher. They're really getting high. For CBD, most of the high CBD strains are even like 10 to 12%. I think, Charlotte's Web or some of them may get up to 16 or 17. I don't see anything too high. I don't know if there's any in the 20s. Maybe there are some now that I'm just not aware of. But I've never seen, I'm pretty confident in saying that there's nothing that's going to be like 30 to 35% CBD and 35% THC. There's just strains that aren't really out there on the market like that. So not really up too much else to kind of comment there, but just something that I kind of thought was a little bit interesting. Another thing that, patients talk about, and I think this is, patient driven or patient centered, they did discuss terpenes. And so, a lot of people do have a basic understanding now of, the two major cannabinoids, THC and CBD. At least most cannabis users do. In terms of terpenes, people do ask a lot about terpenes, and, some people, think that terpenes are really what gives certain cannabis its effects over other strains of cannabis. And so terpenes, we know, we've had a lot of studies in test tubes and animals that have shown that they've had, some kind of effect. And we can see that, myrcene is, for example, a terpene that, tends to be more associated with being sedating, whereas say like pinene is something that's, tends to be something that's more with, cognition, so to speak. And so, in terms of, do we know, do the terpenes within the cannabis that we're getting, is it really, producing these desired effects or these effects that people are reporting? And so, that's where it gets kind of interesting. And unfortunately, we sort of still relying a lot on kind of like anecdotal evidence with that. Like, I don't think we have too many or even any studies really out there showing that when you have like a certain strain and then you add, say, one terpene to it, it produces this effect. But then when you add a different terpene to it, it produces another effect. We unfortunately just don't really have the strains out there, the research out there right now. So we're more or less just relying on, some of the things that people are reporting, and then, mechanistic studies, which is, obviously not ideal. And so, what does this leave, or what is this, what are the main message then for someone who is, buying cannabis and using cannabis? I'm not saying that you shouldn't know your terpenes. I think that you should know your terpenes and that you should look at them when they're on the label and try to get the terpene that you feel is going to match up with the desired effect that you're looking for. But I will say that, take it a little bit with a grain of salt. So don't expect for miracles. Don't expect for, because you're using this particular compound, like say you're adding myrcene to some THC, that, this is definitely what's going to work for helping you put to sleep. Maybe it will. I hope it does. I hope it works. But again, we don't have super strong evidence right now to indicate that, terpenes are making a gigantic effect overall on people, on the effects of cannabis. But again, very, very, very interesting, molecule. And, a lot of people will say that when they use strains higher in myrcene, that they do sleep better. And so, it can't all be anecdotal. I do think there is something there. And again, same with like the pinene, I don't think it's all anecdotal. I do think there is something there, but again, no RCTs on this, no randomized control trials on most of this stuff. So, select the terpene that you feel is going to make the desired effect you're looking for, but don't get too upset if you don't get the desired effect. Because like I said, we don't have a ton of clinical studies here to back up the evidence. So that's where I'll kind of leave things on terpenes. In terms of other things that he discussed in the podcast. So I thought it was interesting when he discussed psychosis. I mean, obviously psychosis is, probably one of the biggest or the hottest topics on cannabis. And, something that is obviously should be discussed because we know now that cannabis is legalized in Canada. It's probably going to be, legalized federally at some point. I think it's legal now in 24 states or something like that. So, half the country more or less in the United States is now, legal. I think that's correct. Maybe someone can fact check me on that, but I think I'm correct on all that. And so if we're introducing this medicine, we got to make sure that, people aren't getting sick off of it. And so, what they discussed in the podcast, Dr. Matthew Hill and Andrew Huberman, have rates gone up of schizophrenia, things like that. And do we have good hard evidence that say, cannabis causes psychosis? So I will say overall, the main message is something that I've kind of repeated on here before. Other physicians have repeated on here as well, is that if you have a family relative, like a first degree family relative who has schizophrenia or has bipolar, you may have a really, really bad time with THC, and it may in fact induce a psychotic break. In addition to that, I would say that just go one step further and say that in addition to, inducing a psychotic break, it may also make the psychosis of the disease overall potentially worse long term. So, some people, will use cannabis and, they have one psychotic break, and then, potentially they don't use it anymore. And, they're more or less back to baseline, or at least they're not having psychotic episodes from cannabis or cannabis-induced psychotic episodes. But if you use cannabis and you are susceptible to one of these diseases, bipolar, schizophrenia, psychosis, it may make things worse overall in the long term. So your, overall outcome, your overall quality of life may be significantly worse. So I think it's really important for us to highlight that. But what is probably equally important as well is that we should also highlight the other side of this. So, we've seen cannabis rates go up, for decades. We've seen in terms of cannabis use and in terms of cannabis potency. And the rates of schizophrenia have remained the same. So if cannabis really, really caused, psychosis, I really think that we would have, seen it. And I'm just going to look up here too on real time. I know that Mark Landers had put out something in the on his Twitter. So I'm actually just going to read the whole thing here, and I think that this may give people a little bit of a scientific understanding as to what I'm talking about here with cannabis and not causing psychosis in the general population. So this is from The Lancet. Most reports examining associations between cannabis and psychosis have been unable to adjust for confounding that arises from correlated genetic and environmental individual differences. So again, that's kind of what we were saying on here, is that if you use cannabis and you have, something genetic in you that can, induce a psychotic episode when you use THC, cannabis is not for you. They go on to say, by acknowledging the alternative, compelling, and plausible mechanisms, 3D40 and colleagues' conclusion regarding the harmful effect of high-potency use on mental health is likely to be overestimated. This is from Psych Central. The results of the current study suggest that having an increased familiar morbid risk for schizophrenia may be the underlying basis for schizophrenia in cannabis users and not cannabis use by itself, note the researchers. And this is another one from the National Institute of Health, and the conclusions here are as follows. Substance-induced psychotic disorder appears to result from substantial drug exposure in individuals at high familial risk for substance abuse and moderately elevated familial risk for psychosis. Familial risk for psychosis, but not substance abuse, predicts progression from substance-induced psychosis to schizophrenia. Schizophrenia following substance-induced psychosis is likely a drug-precipitated disorder in highly vulnerable individuals, not a syndrome predominantly caused by drug exposure. And again, that's a study on PubMed. Those are the conclusions. There's more here. There's a lot here. If you want to learn more, just go to, I'll tell you, Mark Landers. So it's MRCKLANDERS. That's it on his Twitter. So it's at Mark Landers. It's his pinned tweet. So all the conclusions are there with all of the links too. So, there's like 10 or 12 of them there, guys. So, I'm not going to go through all of them there, but, the main message again is that in terms of cannabis, it's mostly just in susceptible individuals. Now, the other thing though that I wish they kind of got into a little bit, I don't think they got into it that much at all, actually, was CBD actually may have antipsychotic effects. So it may actually be helpful for people who have psychosis, which is, very interesting, because again, obviously CBD and THC come from the same plant. So ironic that, one thing that could cause psychosis and the other thing, again, not cause psychosis, I just caught myself saying that, but could precipitate psychosis in the wrong individual. And CBD may actually, benefit people who have psychosis. So that's pretty incredible. I don't think we have, a ton of evidence to start maybe, to initiate this as something that, is like a first line treatment. But I think that, there is enough evidence that, we maybe could start using it as an adjunct treatment, or at least to start doing some more studies on it, because obviously, a lot of people are suffering from mental health right now, suffering from mental illness, psychosis, and CBD, has been shown to be effective. So in some animal models and studies. So, we should definitely look into it a little bit more. All right. So another thing they discussed on the podcast was cardiovascular disease and cannabis health. So there were some people, I think, who were maybe a little bit surprised that, Dr. Matthew Hill did sort of caution people about, using cannabis who have cardiovascular disease. And so there was a study, I'm just kind of look it up here right now. And this is from the Journal of American Heart Association, Association of Cannabis Use with Cardiovascular Outcomes Among U.S. Adults. And so they did find some evidence that using cannabis use may increase the risk of myocardial infarctions or heart attack and also stroke. And so, this was, again, an epidemiological study. It wasn't a randomized control trial. It was, associations. So there were some things that I want to note in that study. Because I think actually Examine did a pretty good job of breaking it down. If you guys aren't familiar with examine.com, really, really good place to go get some information on not just cannabis, but on really everything related to health. But again, coming back to this study, so one of the things they say here on Examine is despite a greater prevalence of cardiovascular outcomes, cannabis users had a lower prevalence of cardiovascular risk factors, including obesity and diabetes. They were also younger and had higher educational attainment, but used more tobacco and alcohol than cannabis non-users. So, there may be some confounding variables in this study, hard to kind of say. Examine does say, these results were similar when the analysis were linked to smoked cannabis and to adults who had never used tobacco or e-cigarettes. So, they're saying basically, at least when they, take out the tobacco and e-cigarette confounder, that things still kind of hold up. What I would say on this is that it's hard to do a study where, but we don't really have, or what I should say is that we don't really have evidence on like, what if people are just using, CBD oil? Like, would they have increased risk? I don't think they probably would. And so where does this come from? Well, it probably comes from, two different things. So obviously, the first one is smoking. So we know that, you shouldn't be smoking your cannabis, right? Again, I'm not telling people what to do, what not to do, but the safer way to consume cannabis would not be to smoke it. In terms of vaping, again, that's something that I still want to have another guest on, someone like Dr. Matthew Hill, and get into that, a little bit further. My own perspective still is that vaping is significantly less harmful than smoking. I'm not saying it's perfect, but I do think that it is certainly less harmful, just from the fact alone that there's, no combustion. I think that would produce a lot less, carcinogenic constituents in the smoke. So in terms of the cardiovascular component, if you're smoking it, I think that's one way you can obviously easily just reduce it by, changing to vaping or changing to using edible. I'm not saying that it's easy to do that. I'm just saying that, that is one way that you can reduce your cardiovascular risk. And then the other, thing with that is that if you're using high THC, maybe you should be monitoring your heart rate a little bit. So if you're a naive THC user and you use THC, you will have an increase in your heart rate for sure, which obviously is not good. Now, most people, when they use a little more THC, their heart rate starts to basically attenuate, meaning that, over time, the heart rate more or less goes back to baseline or back to normal. But, that may not be the case for everybody. So, where do the cardiovascular, effects come from? It's probably mostly from, like I said, the, whatever's in the smoke. I think some of the constituents within the smoke can still be damaging and potentially, cause some inflammation. And then also to, the THC itself, maybe that's causing an increased heart rate. And that's potentially, leading to, worse cardiovascular outcomes. But I would say that, when you look at the study as well, like it says even directly in there that that they had less diabetes and less obesity. And that's pretty consistent across pretty much all studies I've seen, is that cannabis users, it's kind of this ironic thing, but most cannabis users are actually way less than the average person. So cannabis users on average have a lower BMI than non-cannabis users, is a better way to kind of say that. So again, those are kind of my main thoughts on, cannabis overall. I think that there's a lot of ways to use cannabis where you would just experience basically zero to no, cardiovascular increase risk at all. That's kind of my thought. Maybe other people think differently, but if there are ways, I think, where you're not going to have any kind of cardiovascular risk, like, for example, just by using CBD oil. So, just kind of leave it at that. In terms of, other things that they discussed on the podcast, I guess I was hoping more that they would talk a little bit about kids and a little bit more. I mean, I know they did touch on it a little bit with regards to using it for kids with epilepsy. But, one thing I think where it's really underrated is that I do think there are a lot of kids right now that are using pharmaceutical drugs where they should actually be offered CBD oil first. I think that CBD is something that is not going to be necessarily effective for all these kids who are coming in. So I'm not saying every kid coming in with ADHD or every coming in with depression or anxiety is certainly going to get better with CBD oil. But I do think that, anecdotally speaking from clinical experience, a lot of, kids do well with CBD oil. They don't get very many side effects. And overall, I just feel much more comfortable, giving a 6-year-old child like CBD oil than say, giving them something like Concerta or like an SSRI. Like, these medicines are, being prescribed to kids earlier and earlier now, and they get hooked on them, when they're, developing their brain, which is, kind of crazy. And like, we talk about, the harms of THC to the developing brain, which I think is, something that we should talk about. But what about, all these other medicines? Like, maybe they're doing some harm that we don't know. The SSRIs, like, moving from, kids to say like, teenagers or adolescents, a lot of adolescents and teenagers, they're being put on SSRIs, which we know can harm sex drive, for example. And, when children and kids grow up and become teenagers, like, you need that, period of life where you have, a high level of hormones, where you want to, take on new adventures, where you want to meet new people, where you want to date new people, and have like your, dating years, so to speak. And, that can potentially be like stripped away from people just because, they're taking a medicine that's sort of like dulling their emotions, dulling their drive, dulling their ability sometimes to even have sex. And so I think that we could do more to maybe, I guess the right word is promote, CBD as a first line medicine for kids and for adolescents. Again, I'm not completely against, SSRIs and stimulants, although, I do really think they should be really restricted in kids, as a last line. And I think that we should be using, CBD quite a bit more. So that's one thing that I, wanted to just mention that I think they didn't cover in their podcast. And again, there's so many things to cover in cannabis and in a podcast. You can't cover it all. They did a fantastic job. So I'm just kind of, being picky here by filling in some of the gaps. Couple other things that they mentioned, one super hot topic, again, maybe almost the hottest outside of psychosis with cannabis, is probably cannabis and memory. Does cannabis affect your memory? And so I remember seeing on examine.com a few years ago that, if you use cannabis consistently and you're a daily user, while you're using cannabis, you will have deficits in your episodic or your recent memory. But if you're someone who has used cannabis and then you, say you use that at night and then the next day, most people actually don't have too much of a memory issue. So, I don't want to say it's basically, zero, but from most of the research, people can use cannabis every night. And essentially, when they're not using cannabis the next day, they don't have any kind of memory deficits. I think there was, for a while, they're just coming back to examine. They had something that indicated that if you use cannabis daily for a long time, could have some, and say you stopped using it, what would happen to your memory? They did say that I think about after a month, your memory may improve a little bit. So you may have some long-term or short-term memory, come back. But overall, I don't think the results were too glaring. So essentially, if you don't use cannabis and you use a little bit of THC, your memory is going to be, your short-term memory is going to be super impaired. If you use cannabis, all the time, and then you use THC, it's likely still that your memory will probably still be impaired. It just won't be as impaired as someone who has, not been using cannabis or is naive to cannabis and then they start using it. And then again, what happens to someone who, uses cannabis, all the time, they feel like there's some kind of, memory impairment and they stop using it. What happens to them? If there is some kind of memory impairment going on, it seems to, come back or so within a month. So again, just trying to kind of have a balanced discussion on it. I do think that, it can affect, short-term memory when you're using high THC. Again, CBD is not going to affect your memory. So, remember that. But THC will. And I think that was more or less what they discussed. But I will certainly ask, Dr. Matthew Hill more questions about that when he comes on the podcast. And of course, if you guys listening have any, questions, please leave them in the comments on my social media, Twitter, Instagram, wherever, and I'll try my best to get those questions answered. So the last thing too, I wanted to chat about, I don't think they covered it really at all in the podcast, but I wanted to talk about cannabis and lung function. There's not really too many studies on this. I'm just going to go over them there's really, if you go on Examine, there's only 3 studies on cannabis and lung function, right? That's it. And so one of them is from 1973. acute pulmonary physiology effects of smoked marijuana and oral, 9-tetrahydrocannabinol in healthy young men. So basically, healthy young men using oral THC. And so, what happened in this study is that they found these findings indicate that both smoked marijuana and oral tetrahydrocannabinol cause definite dilation of the airways, lasting as long as 60 minutes and 6 hours, respectively. So essentially, that's, improving lung function in some capacity. Again, I don't think smoking cannabis improves lung function overall. I think when you chronically smoke, obviously your lungs get damaged. But the acute effects of THC are kind of interesting. Okay, so just, reading a little bit more about the study. After smoking of marijuana, assayed at either 1 or 2% THC, it's very low, specific airway conductance increased immediately, reaching peak levels at 15 minutes and was still significantly elevated at 60 minutes. In contrast, specific airway conductance decreased after both tobacco smoking and deep breathing maneuvers that stimulated marijuana smoking. So, very, very interesting, the effects of THC on lung function. So, if you're using THC orally, again, I'm not saying that it's going to improve your lung function, but, it can increase the conductance, which is, kind of interesting. So that's one study. What do the other two studies say? This one here is from the Medical Science Sports Exercise Journal. And this, again, is from 1986. So a lot of these, unfortunately, are really old studies. And in this one, the conclusion here was exercise induced a bronchodilation in the control condition, but not in the marijuana smoking condition. So, basically, what they're saying here is that when they gave 12 healthy young subjects a cannabis cigarette and had them smoke, what happened after. And after cannabis, the minute ventilation, breathing rate, your VO2 and VCO2 were increased above control from 50% of maximum effort to the end of the test. Marijuana induced a bronchodilation, FEV1, from 4.28 plus or minus 1.0 to 4.43 plus or minus 1.031. And that was still present after exercise. So, there seems to be this vasodilation effect or bronchodilation effect that cannabis has. So kind of interesting. And then the last study here was, association between marijuana exposure and pulmonary function over 20 years. And again, conclusions were occasional and low cumulative marijuana use was not associated with adverse effects on pulmonary function. And again, this was people smoking basically one joint a day for 20 years. So, they said even with very heavy marijuana use, the net association was not significantly different from baseline, and net association with FVC remains significantly greater than baseline. So it seems like there's little long-term exposure to, there's little to long-term cannabis effects on lung function overall. And so the last thing I want to do here is just talk about lung function. So I don't think that they covered lung function in the podcast really at all. I don't think they talked much about, what happens when you use THC or talked about any of the studies on it. Unfortunately, we don't have too many studies on cannabis and lung function. If you go, for example, to examine.com and go cannabis lung function, they're only showing 3 studies. So I know these studies, pretty well. And so, what Examine's saying here is, while smoking per se is seen as negative, infusions of THC enhance lung function, and acute uses of cannabis joints seem to confer more benefit to lung function than drawbacks. So, again, not what a lot of people would think. And again, I'm not saying that smoking cannabis enhances lung function in any way. I think that, if you smoke cannabis over and over, especially if you're smoking too much of anything of any kind, your lung function can decrease. But we'll just get into the studies here quickly for you. So this first one in the New England Journal of Medicine, this was published in 1973. Acute pulmonary physiological effects of smoked marijuana. They don't use cannabis back then, I guess. And oral THC in healthy young men. And so what they actually found in this study was that when these young men, either when they smoked cannabis, which is kind of surprising, or used oral THC, they actually found that there was a definite dilation of the airways. So bronchodilation of the airways, which is, what you want. They clearly indicate here, these findings indicate that both smoked marijuana and oral THC cause definite dilation of the airways lasting as long as 60 minutes and 6 hours respectively. Again, kind of crazy. So, and they do compare this to tobacco, which is good. So they do that. So it's a good study from that perspective. They say, in contrast, specific airway conductance decreased after both tobacco smoking and deep breathing maneuvers that stimulated marijuana smoking. So, very interesting. And again, after smoking of marijuana at either 1 or 2% THC, specific airway conductance increased immediately, reached peak levels at 50 minutes, and was still significantly elevated at 60 minutes. So, that study really, showed that in their conclusions, they had, increased bronchodilation of the airways with THC use, which is kind of interesting. And then there's another study. This was done in 1986, acute effects of marijuana smoking on maximal exercise performance. Again, down here in this study, they did find that there was some bronchodilation. Marijuana induced a bronchodilation can be found in the findings of the abstract. Again, sorry I'm using the term marijuana. Should be cannabis. I'm just sort of reading off the screen here now. And then the last one that I want to share is from JAMA in 2012, called Association Between Marijuana Exposure and Pulmonary Function Over 20 Years. And, the simple conclusion here was that occasional and low cumulative marijuana use was not associated with adverse effects on pulmonary function. So, it doesn't seem like if you're using a low amount of cannabis, I think in this study, they used 1 joint a day for 20 years. So it is, that's exactly what it was. Lifetime exposure to marijuana joints is expressed in joint years, with 1 joint year of exposure equivalent to smoking 365 joints or filled pipe bowls. Yeah. And so, again, I'm not saying that, you should smoke cannabis to enhance your lung function of any kind. That's certainly not the case. I'm saying not to smoke cannabis of any kind if you can, and to, use other methods of using cannabis. But it doesn't appear that, using or smoking a little bit of cannabis, even smoking, a little bit a day, has any detrimental effects on lung function overall. And so, guys, those were kind of the main highlights that I wanted to chat about from the podcast. Like I said, I am going to have Dr. Matthew Hill on the podcast, I believe next month. So that should be out, probably towards the end of next month. Between that time, I'm going to obviously have released this podcast. If there's any questions that you guys have, anything that I didn't cover on this podcast or that wasn't covered potentially in the Dr. Matthew Hill and Andrew Huberman podcast, let me know, and then I'll ask Dr. Matthew Hill on that podcast. And, he's an expert, so he should be able to give me a really good answer. So, guys, I hope you enjoyed this solo episode. I'm looking forward to doing more of these in the future. I think that the solo episodes are kind of something that I enjoy doing, and also too, I find that the feedback on them has been really good. So thank you so much, guys, for telling me that you have enjoyed the solo episodes, because that gives me a lot more reason to keep doing them. So I hope you enjoyed this one. And as always, guys, I'll be back again soon with another podcast.